The morning sun streamed through the blinds of Mercy General Hospital, casting golden strips across Dr. Zara Patel's pristine white coat. She stood by the nurse's station, reviewing patient charts with focused intensity. At 36, Dr. Patel had become one of the most respected cardiologists in the city. Her hands, steady and precise, flipped through the pages as her sharp eyes caught every detail. "Dr. Patel, your 9 o'clock is ready," called Nurse Tanya, handing her another file. "Thanks," Zara replied with a warm smile that brightened her face, revealing a small dimple in her right cheek. 10 years at Mercy General had taught Zara many things, but patience remained her greatest virtue. The daughter of Jamaican immigrants, she had overcome countless obstacles, skeptical professors, dismissive colleagues, and patients who questioned her expertise based solely on her dark skin. Yet she never wavered in her commitment to medicine. "Another day, another heart to fix," she whispered to herself, a personal mantra that carried her through the toughest days. Her beeper buzzed urgently against her hip. "Emergency." Zara took a deep breath and moved swiftly down the corridor. Her reputation preceded her, the doctor with healing hands and unwavering composure. Even in life's most critical moments, Victor Dawson gripped the steering wheel of his pickup truck, knuckles white with tension. At 58, his weathered face carried deep lines etched by decades of working construction sites across the state. The Confederate flag sticker on his rear window matched the faded tattoo on his forearm, remnants of beliefs passed down through generations in his small town. "Damn traffic," he growled, slamming his palm against the horn. The morning commute into the city always put him on edge. Victor hated coming to the urban center, but his persistent chest pain had finally forced him to seek medical attention. His friends at the local bar had recommended a different hospital. "Don't go to Mercy General," they'd warned. "Too many of them working there." Victor had nodded in agreement, but Mercy was the only hospital his insurance would fully cover. A sharp pain suddenly radiated through his chest, stealing his breath. His vision blurred as panic rose in his throat. The truck swerved, scraping against the guardrail before coming to a violent stop. The last thing Victor saw before consciousness slipped away was a family in the car next to him, a black family, rushing to his aid. Code Blue. "Incoming cardiac emergency, ETA 2 minutes." The announcement blared through the hospital speakers as Dr. Patel rushed toward the emergency bay. The ambulance screeched to a halt outside the sliding doors. Paramedics burst through with a gurney, one straddling the patient, performing vigorous chest compressions. Male, late 50s, possible myocardial infarction. Found unconscious in vehicle. BP dropping, irregular heartbeat, no prior medical history available, rattled off the paramedic, sweat beading on her forehead. Doctor Patel's eyes locked onto the patient's ashen face. "Get him to Trauma 1, now. I need an EKG, cardiac panel, and prep the cath lab." Her commands were sharp and clear, cutting through the chaos. The monitors screamed as Victor's heart rhythm deteriorated into ventricular fibrillation. His body convulsed violently. "He's crashing. Get the crash cart." Dr. Patel positioned herself at the head of the bed. "Charge to 200. Clear." Victor's body jumped with the shock. No response. Again. 300. Clear. The second jolt sent electricity coursing through Victor's heart. A faint, irregular beep emerged from the monitor. "We've got rhythm," Dr. Patel announced, placing her stethoscope against his chest. "But it's weak. He needs immediate catheterization. That left anterior descending artery is almost certainly blocked." As nurses prepped Victor for emergency surgery, his eyelids fluttered. Through a haze of pain and confusion, he focused on Dr. Patel's face hovering above him, her expression determined and focused. "Wah. Who?" he muttered, struggling to form words. "I'm Dr. Patel. You're having a heart attack, Mr. Dawson. We're going to take care of you. Stay with me." His eyes widened with recognition, not of her name, but of her face. Something dark flashed across his features before unconsciousness claimed him again. The catheterization lab hummed with focused energy as Dr. Patel guided the thin wire through Victor's femoral artery. The monitor displayed the blockage clearly, a massive clot threatening to permanently damage his heart. Beginning stent placement, Dr. Patel announced, her voice steady despite the pressure. Victor had stabilized enough to remain semi-conscious during the procedure, local anesthesia keeping him from feeling the catheter snaking through his body. His eyes, foggy with medication but alert with fear, followed Dr. Patel's every move. When realization fully dawned on him, his face contorted. You're black," he slurred, the words falling heavy in the sterile room. The nurses exchanged glances, but Dr. Patel didn't flinch. "I'm your cardiologist, Mr. Dawson," she replied evenly, eyes never leaving the monitor. "Please try to remain still." "No. I don't want you touching me," Victor mumbled, attempting to move his arm. "Get me someone else. Someone different." The nurse beside him firmly secured his wrist. "Sir, Dr. Patel is the best we have. Without her, you won't make it." Victor's eyes darted frantically around the room. "Can't have your kind inside me. Putting things in my heart." Dr. Patel's hands remained perfectly steady as she navigated the stent into position. "Nurse Chen, his BP is rising. 5 milligrams of Valium, please." "This isn't right," Victor persisted, his voice growing weaker as the medication took effect. "My family wouldn't approve. Your artery is 90% blocked, Mr. Dawson," Dr. Patel stated matter-of-factly. "My hands are currently the only thing standing between you and death. Deploying stent now." The tension in the room thickened as Victor fell silent, his prejudice momentarily subdued by the reality of his mortality and the absolute control this black woman had over his survival. The monitors suddenly erupted in a cacophony of alarms. Victor's blood pressure plummeted as a new complication emerged on the screen. A second clot had broken loose, threatening to cause a massive stroke. "He's going into shock." Nurse Chen called out, rushing to prepare emergency medications. In that moment, time seemed to slow for Dr. Patel. She faced an impossible choice: abandon the current procedure to address the new clot, risking cardiac arrest, or continue with the stent but potentially allow devastating brain damage. Victor's earlier words echoed in her mind. The hatred. The dismissal of her humanity. For a fraction of a second, human doubt crept in. "Dr. Patel, we need a decision now." The urgency in her assistant's voice cut through her thoughts. Zara took one deep breath. "Heparin drip, stat." "I'm going after both," she commanded. It was a risky, unorthodox approach that few would attempt. "Both?" questioned the resident. "That's not protocol. I can save his heart and his mind," Zara interrupted, already maneuvering a second catheter. "And I will." 3 days later, Victor awoke in the recovery room, surrounded by beeping machines and the antiseptic smell of hospital linens. The morning sun illuminated Dr. Patel as she checked his vitals. "You're awake," she noted, making marks on his chart. "How are you feeling, Mr. Dawson?" Victor stared at her, memories of his words during the procedure filtering back through the fog of medication and pain. "Why?" he asked, his voice raspy. "Why did you save me after what I said?" Dr. Patel met his gaze directly. "Because that's what doctors do, Mr. Dawson. We don't get to choose whose life is worth saving." Tears welled in Victor's eyes, unfamiliar and uncomfortable. "They told me. You did something impossible. Took a risk no one else would have." "I did what was necessary," she replied simply. Victor's weathered hand trembled as he extended it toward her. "Thank you, Dr. Patel." She hesitated briefly before accepting his handshake. It wasn't forgiveness, that would require more than a moment of gratitude, but it was a beginning. "Your grandson is outside," Dr. Patel said, moving toward the door. "He's been waiting all night." Victor nodded, watching as she left and a young black man in a medical student's coat entered, relief washing over his face. Grandpa, the young man said, embracing him carefully. Victor looked at his grandson, then at the door through which Dr. Patel had just passed, seeing with new clarity the world his prejudice had kept hidden from him.